Hey, I'm a psychiatrist, and today I'm breaking down the specific mechanics of psychotherapy. We'll be discussing first sessions versus ongoing sessions, what therapists listen for beyond just your words, how we decide what to focus on, and why some sessions feel off even when most therapists will tell you that they went perfectly well. Now, this topic is extremely important to understand because therapy looks so simple from the outside. It's fundamentally about two or more people talking, but what's happening beneath the surface, because that's where the actual magic happens. And understanding that process can completely change how you or someone you know experiences therapy. If you're new here, I'm Dr. Joseph. I'm a medical doctor specializing in psychiatry, and I offer quite a bit of therapy in my practice. So this is a topic that's really close to my heart. My main goal on this channel is to make mental health make sense for you. So please let me know how I'm doing in the comments below. For our very first points, let's talk about what actually happens in the first therapy session, because it's very different from every session that comes after that. In that first session, therapists are doing what we call an intake assessment or diagnostic interview, which means we're gathering information, lots of it. We're asking about your current symptoms, when they started, how they're affecting your life. We're asking about your history. So we're talking childhood, family, previous mental health treatment, medical conditions, medications, and even substance use. And this feels very different from regular therapy because it's way more structured. It's more question focused. It's less about the deep emotional processing and more about just us understanding your full picture. Now, for example, a therapist might ask, have you ever experienced a period where you felt really high energy, you didn't need sleep, and you also made impulsive decisions? Now, you might think, why are you asking me this? I came in for anxiety. Well, in this case, they're ruling out something called bipolar disorder because anxiety can be a symptom of multiple conditions, and we want to understand what we're actually treating and make sure it's the right therapy for you. Also, that first session typically includes a safety assessment, which means asking about things like suicidal thoughts or self-harm or violence risk. And this isn't because the therapist thinks you're dangerous, it's because we need to know if you're in crisis. Because if you are, the treatment plan immediately looks different. We're also listening for patterns. Do you mention relationship conflicts multiple times? That might be a focus area. Or do you describe physical symptoms alongside emotional ones? That matters. Or are you downplaying things? Are you catastrophizing? These patterns give us valuable information about how you process and cope with things. Now, here's what the first session is not. It's not where the deep therapeutic work happens. You're not going to resolve trauma in your first session. You're likely not going to have major breakthroughs either, and that's okay because that first session is about building a strong foundation. So by the end of that first session, or maybe even two, a good therapist should be able to give you a working formulation, which is basically, here's what I think is happening, here is what we might focus on, or here is what therapy could look like for you. So after this intake, ongoing sessions shift. They become less structured. They become more focused on themes and patterns because the therapist isn't primarily gathering information anymore. They're now helping you process, explore, and change patterns. A typical approach to ongoing sessions might start with, what's been on your mind this week? And from there, the direction depends on, what you bring and what the therapist is tracking over time. Okay, for our second point, let's talk about what therapists are actually listening for during sessions. And this is where therapy gets really interesting because here's the thing, you're talking about your week, you're describing conflict with your partner, you're venting about work, and it might feel like the therapist is just listening. But what we're actually doing is tracking multiple layers simultaneously. We're listening to content, so what you're saying, but we're also listening to process how you're saying it and how often you're saying certain things. Okay, let me help you see this. Think about someone who comes in and says, yeah, things are fine, work's busy, partner and I had a little disagreement, nothing major. And they're smiling. Their voice is kind of upbeat, but your leg is bouncing and you're picking at your fingernails as they're talking. Also, when they mention the little disagreement, your jaw tightens. Now, a good therapist notices that because what they're saying, which is things are fine, doesn't match with what your body is communicating. And that mismatch is important information. We're also tracking themes over time. Maybe in week 1, you mentioned feeling dismissed by your boss. And in week 3, you talk about your partner not listening to you. And then in week 5, you describe a fight with your sibling where you felt unheard. You might not connect these events, but the therapist has seen a pattern there. Perhaps maybe this person struggles with feeling validated in relationships. We're also noticing emotional shift in the room. So when does your voice get quiet? When do you change the subject? When do you laugh nervously? These moments often signal something important beneath the surface. And here's the big one. We are tracking the therapeutic relationship itself. So how do you interact with your therapist? Do you apologize constantly? Do you avoid eye contact when discussing certain topics? Do you get defensive when the therapist offers a different perspective? Because these patterns in the room, they often mirror patterns outside the room in your regular environment. So I hope you begin to see that therapy isn't just about the content of what you're discussing. It's about noticing patterns, making connections, and gently bringing awareness to these things that you might not see on your own. By the way, if you're finding this video helpful so far, definitely subscribe now so you don't miss future videos like this. You're also helping spread mental health awareness by making this channel more visible to other people like you. So, thank you. Our third point, how do therapists decide what to focus on during a session? Because let's be honest, most people walk into therapy with a million things on your mind. I mean, there is work stress, there are relationship issues, family drama, childhood trauma, anxiety about the future. I mean, so much stuff. And you might be thinking, where do we even start? Well, I'll tell you how good therapists navigate this. First, we're looking for what's most pressing right now. If you're in crisis, so let's say, you're actively suicidal, or you're in an abusive relationship, or you're having a severe panic attack, these take priority. We're gonna dig through your childhood trauma when you're in immediate danger right now. We're addressing safety first. Second, we're tracking what's causing you the most impairment right now. So maybe you mentioned 5 different stressors. But 1 is keeping you from sleeping. 1 is making you avoid social situations. 1 is just annoying. Well, we're going to focus on the one that's actually disrupting your life the most. Perhaps the one affecting your sleep. Okay, third, we are following your lead while also noticing patterns. So if you bring up the same issue repeatedly, even if you frame it differently each time, that's telling us something. So we start to think, this is the thing that's really bothering them, even if they're not saying it directly. For example, think about someone who says, I don't know why I'm so stressed about this work project. It's not even a big deal. But then guess what? They've mentioned it multiple times in 3 straight sessions. The therapist might say, I noticed that this project keeps coming up. What do you think that's about? Because guess what? Repetition often signals importance in therapy. Okay, fourth, we're considering the therapeutic goals. Because in good therapy, you and your therapist should have agreed on what you're working towards. Maybe it's to reduce anxiety, or it's to improve relationships, or maybe it's to process trauma. Those are generally goals that guide what we focus on over time. Now, here's where it gets nuanced, because we also notice themes of avoidance. So if every time we start discussing a particular topic, you suddenly remember to talk about something else, that avoidance is information. It tells us there's something here that's difficult. Maybe we should explore why. Okay, at this point, you're probably getting the idea that good therapy is collaborative. The therapist isn't dictating what happens in every session, but they're also not just passively listening. They're actively guiding the session based on patterns, based on goals, and based on clinical judgment. Okay, our fourth point, let's talk about why some therapy sessions may feel off or even unproductive. Because the reality is, not every session is going to be a breakthrough. So let's talk about it. Some sessions feel flat, some feel awkward, and some feel like you just talked about nothing important for an hour straight. And I've seen many patients panic and say things like, is this therapy not working? Should I quit this? Well, let me explain what might be happening. There are a few reasons why you might feel that way. First, therapy is not linear, and progress doesn't happen in a steady upward line. It's more like 2 steps forward, 1 step back. And sometimes you're just integrating what you learned in previous sessions. And that integration period, feels more quiet and less active. Okay, second, some unproductive sessions are actually really productive, but they just don't feel that way. I'll explain. Let's say you spend a whole session talking about something mundane. Let's say you talk about grocery shopping or your daily routine, and the therapist notices that you seem calmer and more grounded. You're less anxious. Now from the outside, it looks like nothing happened, but that session provided stabilization, which is also very valuable. Third, resistance is normal and expected because sometimes you come into therapy and find yourself unable to engage. You might feel shut down or defensive, or you may even keep the conversation at surface level. See, that resistance is not failure. It's actually information for yourself and the therapist. It tells me as a therapist that we're getting close to something difficult and maybe we should slow down and build safety first. Give you an example. Take someone who's processing trauma. They've been doing really good work for weeks and then suddenly they show up but they can't access any emotions and everything feels numb, right? That's probably the nervous system saying, this is too much right now and we need to pause. A really good therapist would honor that. They wouldn't push them at that time. They will help you regulate and build the resources to carry on sustainably. Fourth, and this is super real, sometimes you're just having a bad day. You're tired, you're distracted, you're not in the headspace to do deep work, and that is okay. Therapy doesn't have to be super intense every single time. So, you see, the idea that every therapy session should feel productive and meaningful is not realistic. It actually sets up an impossible expectation for both you and your therapist. What matters more is the overall trajectory of your care. Are you seeing changes over weeks and months? Are your psychological patterns shifting? Are you developing new skills and insights? That's actually what indicates that therapy is working. Our fifth point is about what actually makes therapy effective. And quite a bit of research actually shows that the therapeutic alliance, which means the relationship and connection between you and your therapist, that predicts outcomes more than the specific therapy techniques that are used. Which brings us to the million-dollar question. What does a good therapeutic alliance look like? Well, I have a list for you. 1, you feel heard. Not just listened to, but genuinely understood. See, your therapist gets you. They remember the details from previous sessions and they notice patterns that you don't see. They also reflect back what you're experiencing in a way that makes you feel validated. Okay. 2, you feel safe. Safe enough to be vulnerable. Safe enough to admit things that you've never told anyone. Safe enough to maybe even cry or be angry or be shut down. And the therapist does not judge you. They just hold space for whatever comes up. 3, you feel challenged, not attacked, but gently pushed towards progress. A good therapist doesn't just agree with everything you say. Instead, they offer different perspectives. They point out contradictions. They ask questions that make you think deeper because that's honestly where the growth happens. 4, and this is huge, you feel collaborative. The therapist isn't just the expert doing things to you, but you feel like they are a partner working with you. You feel involved in setting the goals. You're given feedback. You truly feel like you're an active participant in your own healing. Now, beyond the relationship, here are some other things that make therapy work. 1, consistency. Showing up regularly, even when you don't feel like it. Incredibly important. 2, honesty. If you aren't telling your therapist the full truth, if you're hiding things, you're minimizing things, you're pretending that you're better than you are, therapy would likely not work for you. 3, practice. Because therapy doesn't stop when you leave the room. The insights you gain have to be applied, and the skills that you pick up in sessions have to be practiced in other areas of your life. Otherwise, it would be truly difficult to really grow. If you found some value in this video, I think you would appreciate this video right here that breaks down 5 questions to ask your therapist ASAP to get the best results from therapy. Also, drop a comment below telling me one interesting point you found in today's video about therapy. I read every single comment, so I'm looking forward to hearing from you. In the meantime, I'm Dr. Joseph, and I look forward to seeing you on the next video.